Go ahead. I read my mind. I'm looking for the pop-up. All right. Can everyone see and hear me okay? Thumbs up from someone? All right, thank you. Julie is going to keep letting folks in. My name is Dr. Tracy Wharton. I'm the principal research scientist in the Washington, D.C. office for the National Network of Public Health Institutes, NNPHI. I want to also introduce a couple of folks on here as well. Emily Costello, who is the NNPHI program manager. She and I are going to be monitoring the chat. She's been a part of this project support for this past year. So we're going to be monitoring the chat, noting questions that don't get answered. So we can answer those and moderate that at the end. I also want to introduce Julia Blesser, NNPHI Research and Evaluation Program Manager. She is helping keep this tech running and facilitating this process today. So if anybody needs any tech assistance or has any questions or anything comes up, please drop a note in the chat. You can either drop a note there or you can message Julia or Emily or myself, and we will do our best to help you. We are so glad to have everybody with us today. We are, as I said, we're recording. So if you do want a copy of the recording, let me go back and you can see that email one more time right here. Please email E2A, the number 2A at nnphi.org. Give us a couple of days. We'll send it out next week to you. Today's webinar is the third of a series about centering community voice in public health outreach. I want to take a moment to acknowledge our funder. This project is funded by the CDC, and the funding stream is specifically focused on expanding vaccine access into vaccine hesitant and under-vaccinated communities during the COVID pandemic. We are deeply appreciative for the opportunity to leverage community partnerships to be able to elevate narratives that have not been part of the dominant conversations. I think I'm trying to advance the slide. We'll see how that goes. There we go. NNPHI is the recipient of the funding from the CDC, and we identified 5 community-based organizations to fund through this mechanism. You're going to hear from one of those funded groups today, and as you'll hear, it's a pretty extraordinary group. NNPHI mobilizes more than 40 public health institutes and 10 regional public health training centers, plus more than 40 training affiliates across 32 states. To learn more about NNPHI, please do visit our website at nnphi.org. Today, we're going to talk about values, nuance, meaningful communications for communities, creating space for being seen and valued, and what community-centered really means when we talk about shared work plans. We have a lot of different roles. I'm sorry, I was just looking at the chat here, right? Trying to keep up. We have a lot of different roles. So at this moment, I want to invite everybody, if you don't mind, drop in the chat. We'd love to know who's in the audience. So what is your role? And if you don't mind sharing, what is your interest in this particular topic? What is it that you are, that drew you to this one? But we'd love to hear, who are you? Where are you working with? What is your role? Are you in public health? Are you a nurse, a social worker, a director of services? Our public health colleagues out there. Give us all a sense of who's in the audience. Go ahead and type that. I see some of you have it in your names. Welcome. We're so glad that you're here. This is a really good audience, man. Look, you guys are from all over the place. College Health Association, awesome. Lantern, where is Lantern Community Services? What state are you in? Ah, okay. So, New York City. Okay. Hi, Angie. We're going to introduce you guys. You guys will get to see Angie. Hear from our team in just a moment, but Buffalo, New York. All right, okay, it's fall so I don't know if it's fall where you guys are, but fall definitely arrived. I'm in the DC and Maryland area, and walked outside this morning, went, oh right, I used to live in Florida, so now fall has arrived. So all over the country we got folks. This is really exciting. I'm gonna go ahead, you guys keep writing in the chat. I'm gonna go ahead and keep talking. Everybody can see that chat. So we will have a Q&A at the end. And the panelists that I'm going to introduce in just a moment can see the chat, and so they will be answering some of these things as they come up and responding to you. So please do put your responses in the chat, engage with us there. Anything that isn't addressed, Emily and I will be noting that, and we will have a facilitated Q&A in the last at least 20 minutes of this presentation, right around on the hour. Okay. So let me say, go ahead.
We just have this one thing for folks who don't feel comfortable sharing their question in the chat. You might have colleagues in the room. Feel free to send a message directly to myself, Emily Costello, or Tracy Wharton, and we will be sure to read that out loud for you and put it in as our own question. So
without your name, yeah. we'll be happy to help you with that. Yeah.
So if you don't feel comfortable sharing, feel free to message it.
Right. Thank you for that. So let me give you a broad overview of this project, and then I'm going to hand this off to our panelists. Project Healings involves a really extraordinary partnership of 5 existing networks, which you can see here on the screen. I'm not going to read those out loud to you. Hopefully you can see those. When the pandemic hit the Twin Cities, Minneapolis, St. Paul, and Minnesota, the Chinese American Chamber of Commerce began reaching out to groups across the area to share resources like food and masks. Through that outreach, bridges were built across groups that hadn't worked together before. So when this funding opportunity came along, they decided to join together and write a shared work plan to address the needs that they had in common and strengthen those relationships for future collaborations to meet public health needs. Obviously, I am giving you a very short version of what is a much more in-depth and complicated relationship building process. But it's a pretty extraordinary group to have come together to address public health needs that affect all of our communities. Their work plan, which you can sort of see here, included a really wide range of activities, including vaccine clinics in geographically and linguistically diverse places, production of materials in 15 languages, and I am not kidding. They're going to show you some of those. And training of 27 young adults. And actually, I was told this morning they have a new cohort of another 31 young adults in media production so that they can immediately put their skills to use as cultural brokers and develop messaging for their own communities. I'm going to share 2 of the videos that some of these folks have created. They're really short. They're 1 minute, about 1 minute each. So these are screenshots that you're seeing here. I'm going to show you Khadija, and I'm actually not going to show you the screenshot from the bottom. I'm going to show you a slightly different one. Hopefully you'll be able to hear the sound really quickly to share some of these videos with you, I think.
There's going to be a vaccine.
Oops.
I thought,
here we go.
I'm not getting it. I thought it was a way that the government could control us. Like, that's what I really thought. Like,
can you see and hear me?
I don't know what to say because that's what I thought. Like, I did not trust it at all. I was like, no, because no. What they mean they got a vaccine? No. But then my goddad works with he's a pharmacist and he works with the vaccine people now. And he told my mom, he was like, no, she has to get it. She has to get it because I have asthma and a whole bunch of other problems and I'm premature, so it's like I'm high risk. So they want me to stay safe. When people my age get the vaccine, they usually say, oh, the same thing I say. They say they got sick for a night. Some people just say their arm was just sore and that's it.
I'm also going to show you Khadija. I'm sorry, I was testing this before, so let me go
With
back.
moms, what we got was when there were some symptoms with their kids, they would call the COVID hotline. And when that happens, it's all in English. And here's a mom who doesn't know any English. The only thing she knows is hello and goodbye. And then you couldn't just take the kid and get him tested. You actually had to call ahead. So we even did a whole tutorial again one day in our office telling the parents that this is the protocol. This is what you have to do. You had to be in their level. You have to talk and have that respect. Let's never give any flyers to anybody. Let's talk to them. Let's literally look at the flyers and script it out. Tell them this flyer says this, but here I'm telling you.
So these are a few of the videos that were created by these incredible cultural brokers who and you can go to the website, I should mention, and link through to Project Healings and go under videos, and you can see there's more than 30 videos there in a number of different languages. It's pretty amazing, including the screenshot on here that I didn't play. So let me really briefly introduce who our panelists are, and then I'm going to hand this over to Angie, who's going to facilitate this. I do want to mention there is a link that will drop at the end for evaluation. Then we hope that you'll share your feedback with us on that as well. So you'll see that at the end. And we will be dropping links in the chat along the way for anything that you see so that you can go and take a look yourself. Angie Huang is from the Chinese American Chamber of Commerce in Minneapolis, St. Paul, Minnesota. Actually, they're all in that area. Tesari Elamine Champion from Encouraging Leaders, unfortunately, is not able to join us today due to a family emergency and sends their regards. Pastor Donnell Bratton, pastor at Overcomers Victory Church. Anita Gate, Zincalaluda, member of the Dakota Nation. Dr. Rodolfo Gutierrez of the Hispanic Advocacy and Community Empowerment through Research, or ASER. And Tsanim Baj of the Hmong Shaman and Herb Center. And I'm going to hand this over to them, and I will be advancing the slides. Angie?
Thank you so much, Tracy. Hello, everyone. I'm Angie. I'm with Chinese American Chamber of Commerce in Minnesota. We have amazing team here for you. We really honored to be able to share our stories throughout our journey at this Project Healings. And this is really a cross-cultural and cross-linguistic movement in Minnesota. We really hope is how could we find ways to connect with each other, particularly during this pandemic. And we are lucky to be able to starting Project Healings, and you will see the 5 different hubs we create. So we are also really engaged beyond just our different ethnicity hubs. We're really thinking another important piece is to engage with the public health workers. And that's why we're here today, really sharing our story, but sharing at a holistic way. Healing is not just about vaccinations. I think healing is really about the trust we can build, and we can starting to change the system. And we have different strategies, and we'll talk a little bit more about how each strategy is supporting each others. But for now, the strategies we have definitely assessment. The first one, we really want our community to tell us where they are at. And you just hear Kajada talk about mom just know the English. Hellos, goodbyes. How could we be able to engage with them at the level they are at? And that's what assessment is so important. The second one is that training. We want to do a lot of training with our own community, but at the same time, the training has to happen also with the public health official. I think that two-way training is going to ensure our community will get a culturally and linguistic appropriate services. Next. And next. And so we also really, after this, we're really thinking about definitely the key information is that information sharing and message creation. And we have choose not to have a centralized message. In our community, we have so diverse culture. We have so many different way interpreting health. So to say, go get vaccine is not enough. So we're really opening up to support each hub to develop their own messages and their own ideas about hesitancy. And each hesitancy within different community are so different. And that's what we have this message creation really have empower our community to do it by themselves. And definitely we have a different kind of campaigns starting, and linked to the campaigns, we have the events. And this is really, really the key. A lot of our community coming out during the New Year celebration, doing the different shaman ceremonies, all these different events are really is the best time to connect with our communities. And lastly, but not least, is that partnership. And I think one of the key strategy, and we have been continue emphasize, you will hear us to say, is that partnership building. And I feel this is really how we would be able to do successfully for Project Healing, is really that partner are in place within their own community, but at the same time, we all connect as a circle. Next, please. Rodolfo, you want to go ahead to give us some update for our data?
Yes, certainly. And thank you so much, Angie. This is Rodolfo Gutierrez, and I am the Executive Director for HACER, Hispanic Advocacy and Community Empowerment Research. I am originally from Mexico, so having a big time here in Minnesota, particularly in winters. I hate Minnesota. I want to go back to Mexico, but I am still here for almost 25 years. And very happy of joining this wonderful project of healings. I just want to remark the intention of the project, bringing some partnership with partners that we didn't know each other is one of the highlights, and particularly the results we did have from this partnership, because an update on the data you are going to be seeing here is that we went from this almost 275,000 contacts to actually, by the end of our final tally, 575 4,400 and 480 people contacted to work with them through general education and outreach. So this updated the number is for me really what counts as the real achievement we did have as working together. Secondly, the number of vaccines we provided all together in different events went up to 1,828. And the boosters that we provided went up also to double the number we do have there, 1,655. Finally, the total vaccine boosters we provided went over to 3,483 vaccines. This said, we still don't have the disaggregation by racial and ethnic groups, but I can tell you that we do have extreme kind of a presence and very obvious presence within the people statewide. And what is really important is that we came all together and collaborated and supported each other with these kind of events. The result is we did have a lot of outreach. And I repeat, over 1 million people were reached out here with these Project Healings statewide. Most of them people of color. And but yeah, we did have some participation all over around the state. Next slide, please. So the project, this is a very small sample of the many different events we were holding, and we were also publicizing them through our different social media outlets, but also we generated something that it is an e-magazine that it is available for you through our website in the Project Healings. And there you can see how things were going on along the time. And it's amazing how everybody was able to send. We were in charge of, say, condensing all the information, but everybody has sending a very huge amount of events they were holding here, there, and everywhere, to the point in which we did have a lot of events going on along the time. Since January to the end of the project, we did have tons of events, and we're hosting or hosted by many different organizations, but in so many cases there were different collaborations. We had, for example, events where we coincided with Asian Media Access, or ASER with ACLA, and ASER with St. Mary's Clinics, and all them coming all together and working together with the different cultural groups, but most importantly, tailoring the events under those cultural aspects, basically, and taking advantage of them. I had the opportunity to be at one big event in Bloomington, where I had the opportunity also to see several partners coming all together, and all of a sudden we were there, 10 different partners working at this project Healings, showing many different kind of um, opportunities and approaches, culturally speaking, to the
Tracy,
different
can you
communities.
go back the slides
Yeah,
one?
please.
Yeah. Yeah. And I think Rodolfo, you have a really great point. And I think all the photos show we are at the Vietnamese New Year, for example, and then we are at the restaurant, and we are at the Cambodian temple, and then we are at the arts gallery, and then we are at the schools. So it really is like Project Healing is being seen not just as a clinic, but they are really supporting where our community are at. So we join them, we want to bring the clinic to them so they will feel safe and they will want to do the vaccine.
Yeah, thank you. And yeah, that is really important. And also, with this, we discovered that we can talk to each other, even though at the beginning we didn't know each other. So this is for me also very, very important, showing that healing is something that we all need the same way, and we can all come together and work together to achieve that healing process. Next slide, please. Um, Actually, what you are going to be seeing in the next slide is also more examples of different events. And I guess here, Angie can talk about the effort of creating more dissemination materials and visual materials that are really astonishing.
Definitely. And I think at the right-hand side, you will see our young people are really involved in producing. A lot of times they are our messengers, but they are not just to say, this is what I believe other peers like to hear, but they really roll up the sleeves, participate, learn how to do the productions and produce some of the short PSAs and also some of the graphic postcard you're going to see. So I feel this such a collaboration, not just at our generation, but our next generations really also involved. So we see this type of project healings, it's coming from all different directions.
Yeah, that's true. And we wanted to be very careful and show that many different directions. And you can see, even if you go through the e-magazine, you can see the many different interactions we did have also with local health providers in many different areas. And also Minnesota Department of Health was part of this effort in so many ways. The University of Minnesota supported us in many other different events. All in all, we were seeing kind of an expansion of this group of people who were coming together with different representations for different organizations and cultural groups, and projecting our work way beyond that in our collaboration with other agencies that were not formally speaking part of the project Healings, but they were supporting us all the time. We did have a special presence, as today we are continue generating these reports as to what the partners continue working on, and we hope we can deliver more information, because what it is obvious here is if we continue working together, we are going to have better results. So this is on for you
Yeah.
to read about. And Angie published a lot of articles in it. Myself, I was trying to disseminate some information, and any comments will be really welcome. Angie.
There's a question at the chat to asking what other media channels we put it up. Definitely YouTube, and we also grouping everything into our Asian Pacific Minnesotan TV. We have our own television channel as well. And each hour, for example, we have one partners running a Somali TV. So each and Vietnamese television broadcastings and the Hmong television as well. So you can see each one of our ethnicities do have some small distribution channel. And that's really is very helpful to be able to connect. And then we are really be able to to have a hub to really dispatch all these video out, and then they will share at their local ethnic television channels, and at the same time really broadcasting to the public through the YouTube. And the most impressed things is the young people, because they produce themselves and they share through their own Facebook. I feel that is really powerful, because that's really is the peer-to-peer education, which we really hope to see happen.
Yeah, and I must add that even for us, we have the opportunity to bring some visuals, videos, and those videos were shown by Univision, both locally and nationally, by the way, and also local outlets for Latino TVs and radio stations were presenting our work, and also finally some newspapers locally published different articles, and the articles were, as Tracy wrote here, developed in partnership, involving also public scientific evidence, and also we try to use a language that people could really
Aldova,
easily
shut the
understand.
fuck up.
Thank you for that. And
I'm sorry,
so
I'm going to
next
jump in.
slide.
If we do have
Hey, I'm sorry. I'm
people-
gonna jump in. Please mute up Tracy. Thank you.
we are, if people unmute themselves and curse, we will mute you once. If you come off again, we are going to just eject people from the webinar. We understand that there's noise in people's backgrounds. It's the joys of working from home in different locations, but we appreciate people staying muted, just so that we don't have tech glitches with the panelists. Thank you so much.
Thank you.
Well, next slide, please. So also we publish in many different languages, and we publish in Spanish, but also Angie can talk about this effort that was to translate different materials into many different languages. Angie?
Yeah, this is really, we publicize majorly 6 articles, and each articles is really reflect different cultural hesitancies within different communities. And then we translate into about 11 languages, definitely Spanish, and few Pan-Asian languages and few Pan-African languages. And at the same time, although this is more professionally produced, we also encourage, at the right-hand side, you will see 2 small flyers, and that's produced by our young people. And our young people taking that opportunity and publicize in their heritage languages, and really hope to share with their families and the larger community as well. So I think what we're trying to do is have a holistic approach. It's not just targeting who maybe parents, maybe they are the key messengers, but at the same time, we feel the youth also has the way to share their own perspective with their peers as well. So, and not just English, and they are also utilize heritage language specifically. And you will see here, we have about 30 plus languages and publicized throughout the website. Next, please. We really hope is not just sharing today with what we have done. I think that is some of the information love to share with to build that contact. But at the same time, we hope to have an opportunity to really share is what would be a model we can use and share with you all. And particularly, we focusing a lot at the cultural intelligence framework. And on the left-hand side, definitely the agencies and individual level. And at the next column, we want to do assessment. We want you to feel where you are at. A lot of time when we do assessment with your own cultural intelligence, we really see some of the rejection as well, but all the way we can go up to the integration. And that's really is what is the final goal we hope to have. Within this different level
Fake
of
news.
assessment, how could we be able to have a better understanding, particularly developing along the cultural health? Can we we have a black bar at the screen. Thank you. So we really want to see is how cultural health and how the cultural dimension that impacting on the cultural communication. So, and as we all know, the culture is like an iceberg, and the iceberg is having 1/10 of iceberg on top you can see, such as your language, your costume, your dance, music. We can see each other culture very clearly. But underneath 9/10 of that iceberg is the harder part. For example, we just joking about Asian time. So time is a different kind of concept in Western. Time is money. You cannot waste time. You have a very specific time and schedule meeting to meet. But in Asian time is whenever you show up, you show up. We have a longer party time, 12 hours from the sunrise to sundown. We have all these different ideas about time because the time is a circular. The time is always coming back. So when you have appointment at your vaccination at 1 o'clock, my people didn't show up at 1. They may come at 3, and then they lost their appointment. They won't be able to get vaccine. So, and it's very hard to convince them to come at 1. Sometimes this is a very different concept. So instead of doing scheduling, we just say we will have a vaccination from this time to this time. Come when you can. And we don't feel waiting is a problem. So we can chit chat with each other. We having a good time to wait to get vaccine, but we come at when we can. So this is really is that cultural concept we trying to communicate is all this different level. How could we be able to starting to design the program to support those level? And that's what that cultural integration's coming in. So we will talk a little bit more. And I think one of the big things is asking question, building relationship, and starting to look into what would be the differences, what would be the similarity, and how could we integrate those cultures together. And I feel a lot of time, this whole almost 3 years now, we learn so much from each other. Even just from within our own community as the Asian Pacific community, we still has a lot of subgroups, and we learn so much when we develop all these different kind of strategies and really build on that foundation of relationship. Next, please. Next slide.
Sorry about that.
Before we get into more in depth, we hope to really clarify a lot of concepts. We keep calling it cultural intelligence because we're trying to avoid to use the cultural competence. So a lot of time competence seems like you have a benchmark. When you reach that benchmark, you're done. So we really hope is people can think about this cultural intelligence as a way of the learning. You will continue to learn. You will always be able to learn, just like IQ and EQ. We hope CQ, cultural competency, and become cultural intelligence. So people will understand, they want to be smarter and smarter, and they want to continue to learn this and improve your cultural intelligence. And one of the things we also want to clarify is different level. And we know some of the things within our own community-based communities. We have cultural specific program. So when we go to a mainstream community, we have a culturally responsive program. That is when you translate some of those material into Hmong, for examples, or you have interpreter come in to help you. So we respond to our community needs. So the last one we hope is a cultural integration. How could we be able to have that bicultural concept and practices? So each culture is in its equal. So it's not just mainstream cultures and trying to translate material to Hmong, but starting with how could we starting to build some program, really integrate some of the mainstream concept, at the same time have that cultural component as well. So this culturally specific, culturally responsive, and culturally integrated. And all these are equally important. I don't think so there's one over the other. That's really basing on your own resources and your community level of services you can provide. I think that is really key. So that's what a lot of time when we do program, we may just providing the Hmong languages services, because that is some of the Hmong seniors will come in. So we only offer culturally specific. So that is different level, and that will continue to talk about this different level throughout our presentation. Next, please. This is really some of those key points will help us to build a very strong coalition. Anita, do you want to talk a little bit about that relationship we have built? You're unmute, please. You mute, so.
Hamatakiapi. I'm saying hello, all my relatives in the Dakota language. And prior, I saw a question, introduce yourself from each group, and Angie Wong represents all of the Asian groups. And I've done a lot of work with relationship building in Minnesota among the Native community, but our philosophy stems from connecting all of the nations, through the medicine wheel that represents and as far as what how we've grown this summer, we made the best of the epidemic, and we created many programs outdoors with at least 5 youth groups, and we grew organic practices. We have grown a bounty of food and had education around health prevention, and especially some of the lost, cultural health benefits of a lot of the what we call Watoto Peji, and that means herbal medicine. And so there's a lot of teas and tinctures that in my community have been scientifically proven to protect our body and to strengthen the human cells to the point where the disease doesn't, including the vaccine, really has benefits. So going back to this summer, we had a weekly check-in, and we were fortunate enough to have a retired medical doctor with us who presented a lot of the information to our youth, and we had a lot of discussion groups so that it was all the represented groups, Native, Black, Somalian, all of the groups coming together and giving their input, and then also working together daily how we would go about the day using a lot of the COVID protocols. So they learned a lot of from growing to going to we have a community kitchen where they learned food service, and also ways to cook the nutritional food and their benefits. And we would have we had a couple of assemblies from several organizations. We even had USDA there, and so our relationships just bounded this summer, and we took advantage of how nice it was outdoors. And with that,
Thank you so much, Anita.
Mhm.
So, Donnell, do you want to identifying shared goals?
Yeah, absolutely. Hello, everyone. I am the pastor of Overcomers Victory Church. My name is Donnell Bratton. It's definitely a pleasure and an honor to be able to present to you all of the work that we've done over the last, I would say, feels like years, but it has been a rewarding and a wonderful experience. Just a little bit about identifying shared goals, and I'll say more later on in this slide, is that one of the things that happen when you're dealing with cultural, different cultures and different intergenerational groups. One of the things that does not happen in our culture and in America is us sitting down, having a conversation. And that's one of the beautiful things about our group, is that when we first started, it was many conversations through Zoom, telephone calls, just talking about our differences. And I think that is the most beautiful thing that we can do as American people that live in America, that have a conversation about who we are, who we serve, and what we do. And then out of that, we were able to talk about the goals and what we would like to see. Yes, there was differences, but there was a common goal. And that was the beautiful thing about our conversation. And you'll see more later on in the slides, and I'll jump back in at that time to explain a little bit how that looks as you're looking at this slide. And again, thank you, and I'm so glad that you are with us.
Hey, Donnell, can you just mention a little bit about that vaccine hesitancies, and
Sure.
we share different goals. Each community come in at different level, and how you see that and how you be able to really serving that neutral position.
Sure, absolutely. I was going to mention it later, but I'll do it now. But one of the things is that our communities, especially the religious community and cultural community, me being a Black body individual, I'm also a Christian or a faith-believing person in the religious community. And I grew up in the time, and I'm going to tell my age just a little bit, but I have a mother and I have ancestors, older elders that are in our community, that in regards to vaccinations and in regards to medication, our religious community frowned on it a little bit when you're older, and kind of like perpetuated that conversation to the younger generation, going back to the Tuskegee Tuskegee experiment, where these people, quote unquote, are coming to try to kill us with, or use us as test dummies, or the medicine is going to alter our DNA, or it's a sign of the New World Order. They're going to put chips in our bodies, and they're going to try to control. So those different conversations came up. And then in my experience of identifying some of these goals, it was important to me that we educate not only our elders, but the religious community that have received these conversations, be it in the church or be it in their homes, to explain to them that it's more, as we take care of our spiritual bodies, it's important to take care of our natural bodies. And so there was just conversations, and I think the education piece was very key, especially coming from people that look like me, when we are talking to them, that they can receive it better when it's coming from a person that looks like them, versus then people that they have been oppressed with, or oppressive behavior or systems over the years. And we see it throughout history, Jim Crow, and then you go back to slavery. And so some of those things were conversations that were happening in our communities, about educating them on the importance of understanding health and understanding that these myths are myths and some of them are not the truth. So going really digging deeper and showing them. It was a show and tell. So, and I can talk a little bit more about that also too in our other slides too, in examples.
Thanks. Zanine, can you pick on the building a shared work plan?
Thank you, Angie, and thank you, Donnell, and the other previous presenter, and welcome everybody. My name is Mphi. I'm part of the Hmong community here in the Twin City, as well as I would say probably universally. And I'm the current director of Hmong Shaman and Herb Center here in the Twin City, Minnesota here. It's not so much about building, but it's more like coming together and sharing and confirming, because the work plan, especially in my community, it's already one of those unwritten work plan, but it's important that we put in writing and share. So the best thing about this coalition is the healing project is that, you're thinking that physically we may appear different, but culturally, spiritually, and economically or academically, we all seem to be pretty much alike. So it's more like just coming together, sharing, your goals and your work plan and what you try to achieve. Just so fortunate that in the Hmong community, we just happen to be one of the most, I would say, for lack of better wording, more primitive than any other, or not as developed or not as established as any other community, whether it be in the Asian, Pacific Islander community here in Minnesota, or generally in the world. Because the one thing is the written language piece. We have not have a developed written language, until just the 1950, using the Latin or the English alphabet to mimic our tone, our sound, just like the pinyin in China. And then the other even more difficult piece is about the herbs and the cultural or the spiritual healing piece that we the word that we actually use in the community is that we are still home-based, meaning we have no temple, we're in no community center that we will take our spirituality or our cultural healing practices to such a facility. So everything is still happening in the house. So when that happens, whether being spiritual or herbal, it's still very difficult for people to, bring that into the mainstream and also to standardize it. So each household has their own different way of viewing, especially Western way of treating illness or providing prevention works. So it's really difficult. So although again, the work plan, we have shared goals and we have commonality in a lot of the work plan that we do here in the Twin City. The Hmong community especially still have a lot of challenges, and again, mainly because of the language piece, and we're not that established. So when we try to interpret or convey the message from written English and spoken English into written and spoken Hmong is very difficult. And then the other equally difficult piece is the fact that we are home-based. So it's really hard to bring the individual or the community and the family or the community into a center or into a place like a clinic, or even when we host, a clinic to do vaccination, is difficult for the individual to come to utilize and such centers. So we do have a lot of challenges, but then we're happy to be part of this coalition that we could use that as an example that not only just us, but look at these community that there was time where they are struggling just like we are doing right now. So just be more positive and have more positive outlook in regarding to mainstream your services and in value and utilizing the mainstream or the community-based clinic or vaccinations or whatever mental or spiritual health that anyone is seeking. So again, just kind of wrap everything in a couple words, but I'm here. If anybody have any questions, then we'll elaborate more on later on the slide. So glad to be part of this panel today, and welcome everybody from, I guess, throughout the nation. So welcome everybody.
Hey, Zening. I remember when we do the work plan, we just say, vaccination clinic, but you really take that vaccination clinic and you turn it into a cleansing ceremony. Can you talk a little bit about that? So we all have that ideas about, yes, we're going to do vaccine, but each one of you has really designed it to match with your culture and your religious, and really doing it in the ways to which community can accept. Can you talk a little bit about that cleansings? You have drive-in cleansing, so I think that's really unique.
Yeah, because culturally, every year regarding to the agricultural calendar, every year at the end of the harvest, season, we do what we call it the New Year celebrations. So before you do the celebration, you do the cleansing, and traditionally we just walk through. But last year we, with the support of Angie, Stephen, and the rest of our colleagues at the coalition, the Healing Project, we were able to launch the first time ever drive-through, meaning drive your car and not to walk, because part of the cultural healing or cleansing is, your annual cleansing is you need to cleanse yourself literally and spiritually. So you do that, and then any household equipment or instrument or tool that you use to to feed yourself, to create, to make, and to feed yourself throughout the year, those also need to be cleansed. And I've convinced my community that we always do that for the last 40 years when we're here in America, but we forgot one other household equipment that we use more often than any other is the car that we're driving. So we should also spiritually cleanse the car too. So yeah, so that's just a piece. And in regarding the vaccination, I think if anybody have that mental well-being, or in our culture would be somewhat considered as a spiritual well-being, then the physical cleansing and the physical vaccination would be probably follow. So that's why we're able to use that. And we not only use the cultural cleansing, but we also use other recreational that has been pretty active in the Hmong community in the past, but nowadays we rely too much of iPhone, iPad, and all the electronic, visual cues. So we forgot to be active. So part of that, we also utilize a lot of the cultural instrument, cultural, recreational activity to enhance and to also bring the community and the family together, so that entice not only just the elder, but also the children in the family and community too. So thank you for that, Angie.
For sure. Thank
Yep.
you so much. Rodolfo, let's talk a little bit about challenges we have.
Yeah, certainly. Thank you so much. And well, I might say, well, I'm going to depart from the idea that the system wants us not to work together, and establishes a lot of differences within different groups. And that is one of the big challenges we have always when we try to come and work together, because we see our problems being unique, our own issues kind of identifying ourselves, culturally speaking, different from the others. And that said, we don't have that sensitivity, these kind of possibilities of interaction. The ideas of coming together are even establishing some sort of challenge when we think about the languages we are going to be using, not only and also the geographical areas we are in, and how also we, so many of our community organizations are thinking that they are leading some work within some specific spaces. And so many times they are just afraid of perhaps not having the control of those areas. And however, we were able to see very successful efforts in overcoming those kind of obstacles with us coming together. And somebody just already talked about that, talking each other every week and sharing our successes, stories, and also bringing us together to listen each other, how we were going, how we were doing, and how we were also asking each other for help. The challenges are still there. We still need to go beyond this exercise. We need to really convince about the cultural appropriateness of the concept that Angie was talking about, and going beyond with the cultural intelligence that implies being aware of the differences, but also coming together with what it is common, what it is similar among us. As I said before, we all need heal. The processes can be perceived in different pathways from different kind of groups, but fact is we need to be there. So we can work together, but it's not easy. And it won't be easy if we don't come together and say, develop this cultural intelligence all together to go beyond.
Definitely. And I think I just want to add one last piece is how can we supporting each other's. Luckily, I think this whole Project Healing has a support from the NNPHI, but at the same time, for example, the Chinese Chamber of Commerce receiving funding from MDH, so we can do some additional vaccination clinic. And we also, one of the key points, we set a part of money to really support some of the local grassroots-based organizations. So this part of money they can apply every month, and they would be able to receive support from incentive for even just hosting or just rental. For example, rental a pop-up clinic at their community center. So we set aside a part of money and people chip in to build this pot of money. So the smaller agency, for example, so we have Oromo community would be able to host ones. And then we have another's Laos temple can host one. So using this way, not just relying on the larger part, but each one of us are continue doing fundraising to support the Project Healings, but at the same time contribute to this common pot. So we would be able to say the smaller subgroup can also hosting their own vaccination clinic instead of have all the key partners to do it again and again. So I think that supporting and collaboration is very important. Next, please.
Angie, you asked me to give you a time check. So we had talked about 10 more minutes or so of discussion, and then we'll have question and answer.
Will do. Thank you so much. Next slide, please. I think maybe for the time being, that's I will go ahead to just read through it. Some of those strategy we think is definitely is that self-awareness. That's the assessment we've been talking about, and the cultural understanding. And you can see from Zanane's examples, from Anita using the native herb, using the gardening, everyone is doing different strategy. So that cultural understanding has to be the foundation. And we allow the multiple perspective. So we not just want to centralize with one unified themes, and this is the message, go get the vaccine. No, we really has to respect what each culture would like to have for their own communities. And intercultural communication, we have this so many different ways. Even just very simple things like Donnell has been talking about. Donnell's like to using the phones, just call, and sometimes we like to use the email. So this is a very different way of communication. And you can tell also a lot of time Asian way is we building that context. We spend a whole lot of half hour just to providing Project Healing content without getting the strategy. But that is a very different way of cultural communication. We all have to be aware and how we can accommodate with each other. And definitely Anita mentioned relationship building, flexibility, and also some intercultural skills. It's key. How we be able to listen, how we be asking a good questions is really key for the success. And definitely we have to operate in the multicultural aspects. We cannot thinking about just for our own communities. We really has to have that cross-cultural perspective. Next, please. I will invite all our panelists to join me to give me some examples. For example, the valuing diverse communication styles. Is any other things you like to share and really enhance our strategies?
Well, I'll jump in because everybody's trying to jump in at once. And so I know they're excited to share their stories. But even looking at that, Angie made a comment about our communication styles and how we operate. Yeah, it was difficult because we're so used to dealing with picking up the phone and calling. And there were some times that we would have to set up a Zoom or respond by email. And in our culture, we don't look at our emails all the time. We're used to our phones and texting. And so that was difficult to actually be able to do that. The valuing of our communication styles allowed us to be able to be strengthened in all styles of communication. And I think that transcended to the communities that we serve, that everyone, just because we look alike doesn't mean that we communicate the same. And I would use, for example, even in our community, the African-American community, as we were dealing with these different practices, we also found out within ourselves, and even in our own African-American community, you have Somalian, you have West African, you had the Sudanese population. There were still the differences of how we communicate within ourselves, even though we look alike, but we were from different parts of the world. And so we started valuing how we communicate and some of the genre that we use and some of the way that we joke and some of the ways that we use expressions, and even in our body language can be misinterpreted. And give you one example, and sometimes when you're looking at other people's emails, you don't understand the emotion or the behavior behind the email, and it can be an offensive on the person that is reading it. And so with me being a Black body individual, we are energy type of people. And so I need to, communication for me is to see you. And so, but what it allowed us to do is to be able to be conscious and sensitive to other people's needs and allow us to be able to value each other, and that may have impact our clients' behavior. And so, so it was a learning experience. I'll pause there and give one of our other partners an opportunity to communicate.
I'll jump into. I think the best thing about, for me personally, is that this, healing project or this coalition, and especially from Mphi and the Asian Media Access and the Chinese Chamber of Commerce in Minnesota, that they are welcoming and they're helping us, affirming our cultural practices. So that in itself is really empowering enough. And that's part of what kept me going and kept me keep coming in and be part of this group, is because of that, where you may not find, not only that they give you the comfort of helping you confirm and affirming your cultural value, but they actually, make you feel like you're part of the group. So I think that's an aspect that, as I work in community service for the last 30 plus years, you really find that you have to sometimes insert yourself, and in this group, it's everybody already, understood what you're trying to say before you say it. So thank you so much.
Angie, and something, I don't know if you all can expand just a little bit. There's a great question that came in the chat about the variance of vaccination rates across the different communities. And so Pastor Bratton was just mentioning, and something you were just mentioning, even within the communities, there's a lot of differences, right? So, when we're looking at big groups, not all tribal groups are the same, not all Latino groups are the same, or African-American groups are the same. So I don't know if you want to talk about the differences in vaccination rates and acceptance of vaccines or vaccine hesitation, even within your own communities.
Sure, I'll jump in real quick. It's just one of the things that I forestated earlier in the previous slide I was just sharing with you in regards to, it was very interesting when we had a vaccination event. The response from the community was very hesitancy because of some of the myths that have been presented from religious experiences. So there was a religious aspect, but then intergenerational, Black-bodied individuals, whether you were from the continent of Africa or here in America or a descendant from different various people of colors communities, we started to see a strong hesitancy because of the simple fact that there was myths that it was a mood altering, it was a like a chip was going to be put into your body, or they're trying to control us. I think you saw it in the video that one of the young ladies were saying that they thought that this vaccination was going to be a controlling aspect of it. And so when you begin to look at African American groups, our percentages were lowest because, and this is a part that sometimes make other people of different communities uncomfortable. When you look at what Black people have went through throughout history, you start to begin to question, is the country that you helped make this country great, is it supportive of you, or is this another way of ostracizing us or oppressing us from slavery to Jim Crow? And now we see, obviously in Minneapolis, which we have experienced the recent unrest of, the riots from the death of George Floyd and different people, Philando Costello. And so you have all these different things that take place. And so the conversations that we will have in our community, especially people of color, is this another tactic to cause us to go through some stuff that we've been through from our ancestors or our foreparents or those that we see throughout history? Black folks have been in the situation where they have not been treated fairly in America. And so we started to look at it as, is it another tactic to control or to put us in a situation where they're trying to, is a genocide? Is it that? So if it's not the police killing us, if it's not slavery, if it's not a system of oppression, then now it's a vaccination that is a sense of controlling. So these were real conversations. And this is one of the hesitancies that I heard the most amongst our young African-American young people. And then the older people were just not going. They just didn't believe in, hey, I came into this world without a vaccine, I'm going to leave without a vaccine. And so I don't need a medicine. I treat it like a common cold. I can just pray and drink some water and I'll be all right in the morning. And so those things were conversations that, we had to have them just to hear their concerns, and then we address their concerns. And then, so that right there was the reason why, and amongst African-American communities, the rates were lower. It's because we just didn't trust the government. That was the conversation. So I'll pause for that.
Thank you. That's so, I thank you for saying those were real conversations, because I think we talk a lot about these, and these are really real difficult conversations. I wanted to ask if Anita would share some of, you can see Rodolfo put some of the rates in direct answer to the question, the rates in their region for these different areas. And you can see this huge category of American Indian, which has lower vaccination rates. I know there was a lot of diversity. You had mentioned to me when I came to visit that there was a lot of diversity of acceptance and how people viewed this kind of outreach. I don't know if you can share a little bit about some of the questions that you got and some of the ways that you had to adapt to outreach to the different tribal communities of where you are.
Well, I know I had to have mentioned that we have 11 reservations in Minnesota. And so within that realm, they have their own campaigns with the COVID vaccine. And also within the urban area, there are many clinics, native clinics, and there's an actual organization that's native that addresses only COVID-19 and vaccination. And so I'm sure that all of that gets kind of lost, all of the numbers. But again, in the Native community, the elders it's a struggle because they don't use the internet. Their communication is kind of cut off. So one of my colleagues and several, and I must say the women in our community would organize and bring together kits of preventive medicine like elderberry. And so elderberry has been proven to boost your immune at a level that really helps with not going to the hospital if you catch it. So all of these kits were delivered all over the reservation. And so after they were doing that, then the elders stopped passing away, and so there's a lot of diversity in itself among each of our groups on how we address, if you speak to a traditional Native American elder, they will say that the power of prayer and all of their preventive efforts are what they but I insist to talk about the scientific side of things, so that they understand that it will help your body to be immune to passing away.
Yeah,
You know?
it's so interesting to hear you say the power of prayer, and also Donnell to say the power of prayer, and something to talk about the power of prayer. It is really, even though these communities are so very different, that this is one of those through lines. We have about not quite 15 minutes, maybe like 12 minutes left before the end of our webinar today. I want to remind people and encourage people to drop your questions in the chat. We're going to let people continue talking, and we're going to share some of that. I did get a question I wanted to share with you all, but go ahead and type those in there. You can send it to me directly or Emily directly if you want us to read it out for you. And for those who are on the phone, we have a few folks. I'm going to read this out. One of the points that was raised was based on how the vaccination data are collected. And I know you guys have done such a great job. They send me, as the coordinator of this project, they send me numbers and data and how many people. And as you can see, Rodolfo has a lot of data to share, but depending, based on how the vaccination data, our collection is gathered from public health, we often have great difficulty determining if we are effectively moving the dial. This has been an ongoing challenge. And I want to let you go ahead and I'm going to skip you to the next slide here, because there were a couple more things that you wanted to say, and maybe you can weave that in there about how do you know that you're being successful. And then Angela, I'll let you finish these last couple of slides in the last maybe 10, 12 minutes.
Will do. Thank you so much. I think we talk so much about different cultures, and we really culturally integrate different strategy together. And I really want us to also take a very serious look how we can learn from this virus. The virus is not discriminate, and the virus impact on everyone equally. And the virus is smart. They talk to each other, and they don't have egos. So which dominant streams, if they think is effective, they will continue to produce and communicate at the beginnings when we have a very severe death, and the original stream gradually being replaced by more effectively infection to each other, but with less of hospitalization. So the virus evolved basing on which one is so effective for success, for their survival. And how could we not learning from them? They are just doing it. And also, as Donnell mentioned, communication. It must be some way they communicate with each other. So they will give up that ego and willing to go to the stream, which is more popular base infected, more effectively do so, and then forget about the strain which will cause severe deaths, because that's have a much more a heavy resistance out there. So virus teach us so much, and they never also give up to change. We just have bivalent come out, and the next day we have a new strains, BA.5 coming up. It's just amazing to see how they coordinate all these and how they having a different strategy to fight for their survival. If they can be this smart, we can be better. We can be even smarter to taking their strategy, communicates, and willing to give up your own ego and work with each other and come up with the best strategy. And we just have so much we can learn from them. Finally, me to we. I think this is really one of the things I want to highlight. In English translation, you can say, tell our own story with exclamation. But when you translate into Chinese, actually, they put a question mark. So we are doing this differently, communicate differently, more direct in Western, more polite, inviting for question in Asian. We have to continue to recognize that. And then willingness to accept that ambiguity. They may not have one size fits all. They may not have A to B very clear pathway. How could we work with this ambiguity? Asking good questions, continue the communication, communication. And finally, really advance through convergence of culture, community, and health. I think throughout all these presentations, you can see how we work together. It's not just one part, but it's a continued integration, and realize each one of the culture is in the equal place. And also everyone defined the health so differently. You can hear from Donnell's story, from Anita's, the names, that health is defined differently based on our ancestor experience, their wisdoms, as long as our current situation. How could we not integrate all these three elements together to design our program? So I will invite everyone to give final thoughts, and we'd love to have some question answering. I'm so sorry.
I have a question that came in. I'm sorry, I'm looking at my notes over here. I know that the young people, those we showed the picture and we talked about the cultural brokers who were trained to do the media and those videos that we showed. Someone asked, could you say more about how you recruited them? I know that this was something you worked with Tezzy and Tony from Encouraging Leaders and recruited folks through there. And you mentioned this next cohort is a very diverse group of young adults from lots of different communities who are learning to do this in their heritage languages. I know you had reported that. So the question is, can you say more about how you built that plan and how you recruited them?
Yeah, I think we need everyone recommend their use to us. So community-based agencies invited to make recommendations, and then the youth get paid. We really want the youth to think seriously this, to not just trained as producer, but really starting to think about how they can be the one who writing the story, change the narrative, so they have to be paid. So they would be able to put it serious thoughts into their products. And we open up for everybody and they recommend. So that's what we have so diverse this time, because we have Ethiopians, we have Oromo youth, we have Chinese, Vietnamese, Cambodian youth. They are all really coming in from the community-based agency. So we open up, inviting them to recommend their youth who can be able to speak bilingually is a very important for us, so they can produce heritage language materials. But at the same time, we really want the youth to be honored because they are part of the community. If we all get paid to work on this work, and they should too. So that really helped them to really generate products. And at the same time, we teach that civic engagement, why we doing this, why it's so important to mobilize young people to to using their own ideas. A lot of times cultural heritage maybe have a set, but they may want to integrate some of the mainstream thinking. So that's why we invite them to do so.
Thank you.
Any
We don't have
last,
other, I think you guys have been answering questions as we've gone along. I know you were about to invite everybody to share some final thoughts. And I think I saw Anita coming off.
Go ahead.
I want to mention we did put a link in the chat. Please do share your comments with us in this survey, and you can see some emails up on the screen. I'm going to give it just a moment, and then I'm going to stop sharing the screen as and spotlight all of you so that you can just share your final thoughts.
I'm gonna add that that this is a wonderful experience we've been going through, showing that we can come together and work together, and also that I was going to mention that the data I just put in here is hiding so many things that we need to go through. As you can see there, Asian Pacific Islanders go to the very top rate of 81.7%, but if we disaggregate data to the Hmong community, for example, in Minnesota, we see very low rates of vaccination. So we need to really go and look the details in the information we do have, and we can have more to do in the future, and I am for it. So I really appreciate the leadership that Angie has bringing out to us, and all the wonderful relationships we've been having with everybody here, Anita, Donnell, and CNN. Is being just wonderful, and not only them, but the almost 40 other leaders and organizations that being part of this project. So I am really excited and looking forward for more opportunities to keep up collaborating. Thank you.
Go ahead, Donnell. Final words.
I'll ditto everything that was said. I think that this experience for all of us, and for those of you all to hear our experience, this moment that we had with you all and that we have shared with you all, it's not enough time in a day to explain and to share all of the amazing work that all of us have done, and Rodolfo and all of the our native sisters and Tezzy, who is not on here, but we can go all day about this work. We live it. We're in it. You see us in the community. It's just not just a Zoom call, but we are actually face to face with the communities that we serve. And I would just say these last things. What you just witnessed today is what America should look like, is communities of different backgrounds coming together to work together. We've had some fights and some fusses and some disagreements, but at the end of the day, we come back together and just still help each other and hold each other up. And it's a beautiful thing. And so we're looking to continue the work. And I appreciate you all that came on to hear and listen to what we had to do and what we presented. Thank you.
Deneen, go ahead.
Yeah, thank you. And again, I think I just agree with what the panelists already said. Just let everybody know that we are at the place where the virtual world has brought us all together. So regardless of where we are in the world or in in the nations, we should be accessible, and I'd be more than happy to engage in with an individual or with a individual institution, as you may see fit. So thank you for all the panelists and for all the audience that are coming. I mean, the people attendance that are participating today.
Thank you. Anita, you want to close with a prayer, a native prayer for us to close the session?
O Tukashila, Imakia Pi Unke Miakia Pi. I thank the Creator for the medicines he places on this earth, for us to overcome our this is the 19th epidemic of this world. And I feel very blessed myself for reaching out to all of the youth groups that we had this summer, where we could help them to become more confident about, carrying more knowledge with them about health, about preventive care, and learning how to cook, do food service. They took turns in groups, learning how to cook the meals they like. And I could watch the transformation of just healthy kids. And that's what it's all about. And as Dakota people, in the end, we say, we takuye owasi. That means that we are all related. All of our nations of the world are related, and we must come together. And there's been prophecies that have been told that we will come together in the end. Bidamiyaya.
Thank you, everyone. It's so beautiful. Tracy, close us up. Thank you, everyone, for